Good morning, good afternoon for everyone. My name is Eti Poncorini Pamungkasari from Universitas Sebelas Maret, Surakarta, Indonesia. In this opportunity, I will deliver my presentation about online learning for medical students, how are the implementation and effectiveness. Our member research teams are Atik Maftuhah, Bulan Kakanita Hemasari, Fitri Widyaningsih, Adaninggar Angesti Laras, and Ari Probrandari from Universitas Sebelas Maret, Indonesia. We collaborate with Institute of Tropical Medicine Antwerp, Susan Dirk, and Maria Zolvo. During pandemic COVID-19, there were so much changes in human life for teaching and learning, especially in medical education or medical faculty. Before pandemic COVID-19, maybe majority learning activity held face-to-face. But when we face with pandemic COVID-19, the learning activity changed or moved to online learning. And we know online learning maybe have some barriers when used in medical education. So the aim of the study is to determine the use of online learning and the effect of the COVID-19 on online learning for medical students. This research was a qualitative study conducted in 2022. The research participants were 10 preclinical medical students, 9 clinical medical students, and 12 lecturers from 11 medical faculties in Indonesia. Sampling technique is cluster sampling based on the Faculty of Medicine accreditation. Data collection was carried out with a focus group discussion, and data analysis was carried out by thematic analysis. Then I will explain about our findings. First, about online learning implementation. From information-related use of e-learning aspect, students use the information from the e-learning platform to accomplish their assignment, discuss with friends and lecturers, learn skills lab material from the video, prepare for examination, participate in competition, for example, student competition, and practice counseling for community service. In addition, the clinical student also use the information to review the material before entering the department, studying the most common diseases and compare them with patients, support clinical knowledge when meeting patients, and learn about new conditions and engaging specialties. Other finding about the effectiveness of online learning. The study found that for knowledge component or knowledge aspect, online learning is quite effective. The sources were more updated and conducive and self-focused, clear to see through a laptop screen, but still found some challenges. The student was hard to pay attention and limited interaction with the lecturer, and students tend to get bored and tired quickly. But for learning in skills component, online learning is not too effective or ineffective because it required hands-on practice. We know when we teaching the skills or developing medical student skills, clinical skill, the teacher or instructor need to demonstrate the skills, and then the student will see the instructor or the lecturer what about the demonstration and follow the step on the procedure. and it was difficult to apply theory without direct learning. Online training makes it difficult for students to imagine the skills lab material provided, and they tend to be easy to forget. About the effectiveness of online learning, factors that influence its effectiveness from the application include appearance, user-friendliness, and features that support various two-way learning methods. Other factors are networks, geographic location, student learning motivation, interaction between lecturer and student, and the compatibility of online materials with the practice to be carried out. Our other findings about online learning implementation is about preference of students' studying method. Most students prefer blended learning. Blended learning that preferred by students consists of offline learning or face-to-face interaction and online learning. Face-to-face interaction, they preferred for skills in hospitals, skills laboratory, basic medical science laboratory, and community service, because the student still needed direct guidance and experience. The online learning component are suggested for theoretical class, discussion, collecting assignment, and examination. Because from student perception, online learning will make it a flexible schedule, save time and cost, easier to collect the material, enjoyable, convenient to take notes with gadget, could record for review afterward, and environment friendly. The students also seem more active and conducive because of the recent feature, but there were still many technical obstacles. However, some respondents prefer offline or face-to-face interaction or face-to-face learning because the material presented was easier to understand. Offline tutorials or face-to-face interaction in tutorial session were more lively and can sharpen the knowledge. Students can practice communication skill with passion. And the student felt more pronounced lecturer as a tutor, though sometimes the student were confused during discussion, less conducive, and it was time consuming. About COVID-19 pandemic effect, the shift in the learning process. At the beginning of the pandemic, it was hard to adapt to application for online system. Learning medical skills was challenging because the tools were limited. The simulatory patients were incompetent, and the clinical student did not practice directly with patients using only mannequins. Some content in basic science laboratory and skills laboratory material became online learning through video, and some topics were eliminated. Some universities did substitute offline or face-to-face learning skills lab because lecturers felt that online learning was less effective, but not for activity in basic medical science laboratory and some skills laboratory material. The assignments, such as video and posters, were found to be tricky. Sometimes teachers reschedule learning time into afternoon or night when online learning implemented, and it makes students feel sleepy when attending the online class. The material provided online for clinical students was no different from cases found in hospital or the preclinical material. The cases in the hospital also decreases because decreasing of patients who come to the hospital, and the hospital still focus on COVID-19 patient. So it causing clinical students need more time to learn a few competency achievement and leading to an extension of the study period. For examination, although the student feel less tension, the technical implementation of the examination become difficult in online. The positive effect of this pandemic was the student had increased skills in literature searching and the usage of teleconference application and tools. The students also felt an improvement in teachers' ability to make online quizzes or something else that could make the learning more enjoyable. From the teacher's perspective, this pandemic leads to the optimization of e-learning, which already exists before the pandemic. Its features have also improved for accrediting purposes. Another finding from our study about overcoming the effect of the pandemic from student perception, learned more through sources provided by lecturers, and students watch educational videos on YouTube, discussion with friends, or ask directly to lecturers. Clinical students also discuss using simulation cases or old cases. Some had opportunity to history taking to psychiatric patients through Zoom, engaging in community service held by student organization or university to improve the skills. From lecturers' perception, the effect of the pandemic made e-learning user manual, provided new online learning facilities such as Zoom meeting, personal WhatsApp coordination, adding specific division of tasks and technical staff to increase the platform effectiveness, added additional servers, requests for infrastructure development to university leaders to support the online learning, and hire professional working for e-learning platform development. Our study maybe have some similarity with another study before that found that barrier in online learnings are skill deficit, lack of time, need infrastructure, poor communication, and maybe difficulty to develop good attitude. Online learning can be considered as a potential learning method in undergraduate medical students. And in health education, blended learning showed better effect on knowledge outcome when compared with traditional learning. For teaching clinical skills, online learning is no less effective than traditional learning in undergraduate nurse education. And during the first years of the COVID-19 pandemic, barriers of online learning were the lack of planning and resources, usability problems, and limited interactivity between teachers and students. So our conclusion on this study found several themes related to the use of online learning among medical students, online learning usage, the effectiveness of online learning, and the preference for learning methods. The COVID-19 pandemic has affected the learning process of medical students. Medical students have strategies to overcome problems experienced during the COVID-19 pandemic in learning. So we suggest further research on online learning, especially about clinical skills learning and online learning design that can keep students playing an active role. These are our references, and in the end of my presentation, we would like to say thank you very much to Institute of Tropical Medicine Onward Bergium for funding, and thank you for all the participants attending my presentation.